we want our viewers to know more about what the Alcott Center does and how has it worked behind mental health and the people who are suffering from it.
Sure, I can start us off. The Alcott Center has been around since 1979. We serve the west side, well, now most of Los Angeles County. We're located, our DMH program, our mental health program is located on the west side of LA. And Alcott was started at a time where hospitals were closing down and psychiatric patients were being released into the community for services. And Alcott started actually as a boarding care facility, which is a congregate housing facility, and then got a contract to provide mental health services to its residents. That contract grew over time and is now a community-based facility servicing the entire community, providing adults with comprehensive mental health care. So we provide individual, group, family, couples therapy. We do so in the office, we do so in the field, and of course now virtually. With the pandemic, we've had to adapt to that, which has been actually a good thing. Our services range from providing prevention and early intervention, short-term services, say somebody who maybe is having an adjustment disorder, to the more serious mental illnesses like schizophrenia and those providing longer-term services. Over the last few years, we've really grown a lot. And in addition to our mental health clinic, we operate several housing sites. So we're working with actually the LA County jails, which have been described as the largest mental health facilities in the world. And we work a lot with decarceration, so getting the people that are deemed appropriate by the Department of Health Services out of incarceration into our homes, and then providing them with wraparound care, therapy, substance use treatment, psychiatry, all while they're with us and while we're also locating them permanent housing. We also have an art studio program, which Ashley is very fond of. And the art studio it's not a clinically based program, but it does provide our clients with another option to help them to better cope. Art uses a different part of the brain than doing traditional therapy does. So the combination is really helpful in some cases.
Yeah. Well, I'd love to add that the Art Studio program is also focused on reducing overall stigma around mental health challenges, because they are open to the community virtually, and that way people get a chance to know each other through a medium that I think everybody can enjoy, which is art. And then I did want to add too, in terms of our mental health center, we largely provide services to people that are low income and either don't have health insurance or are on Medi-Cal.
That's amazing. Well, art is something that I have heard previously that Nick, you rightly said, it activates a certain part of your brain that is really good when it comes to fighting mental health problems. But listening about how it can be effective in jails is something that I heard for the first time, and I'd like if you could share some more light on it.
Well, I think art generally works with the right side of the brain, I believe, and therapy can work on a different portion. So in therapy, you're doing talk, you're learning how to cope, you're learning behaviors. In art, I think you're just it's a different way of processing. So it's allowing you to sort of get out of your head in a way, as a way to feel better. And then it also adds, for our particular art program, our clients are able to sell their art products and they receive the full amount that they sell them for. So it really helps to, I think, boost their self-esteem and makes them feel, I think, more a part of the community. So a lot of times with people with mental health challenges, they have difficulty working, they have difficulty attending school, and that all can impact your self-confidence and how you relate to the community. So if you're improving those things, you're also improving one's ability to live in the community and to be a productive member of the community.
And also, I'd like to know, like you mentioned, you also work with jails and prisoners. So, because that is something that I've never heard before. So how is it different from a normal person who is living a normal life?
Right. So everyone we serve has a mental health challenge. I think the people coming in through sort of the regular channels, they don't have the added component. Well, they may, but they might not have the added component of having been traumatized by being arrested or being homeless. They may be people that, someone who moved to Los Angeles and is having an adjustment sort of problem that is quickly treated. They may be somebody who grew up in a family where there was some abuse, but that may be true of somebody who is decarcerated as well. The people coming out of decarceration have typically been homeless at one point. There's obviously the arrest. The arrest is generally connected to their mental health challenge, which can often involve substance use or misuse as well. And then they're coming out with the additional thing of being traumatized by being in jail. And when you're in jail, you're likely not getting the type of treatment that is needed to treat the mental health disorder. So they're a bit more, that population can be a bit more challenging, but also very rewarding to work with. We've had a lot of successes. We've had people who have gotten out, gone back to work full time, gone back to school. They've become a peer to other mental health clients. So really, really a lot of heartwarming stories on both sides. But since we're talking about the decarceration side, I think that's important to mention. And I guess the other thing with decarceration is that it's really spreading across the country. We actually saw a video this morning about it. And it's really something that is spreading across the country. The United States has a lot of people in jails. We have a large homeless population. And with the rents being out of control and the lack of affordable housing, you see more people on the street, and we have a lack of hospital beds. So the only place to put people when there's a problem sometimes is in the jails. And that's not really something that I would consider a fair alternative. I think the alternative is managing people in the community when these are non-violent offenders who just need wraparound, longer-term services.
And I would just add more rehabilitative services, because oftentimes when you're incarcerated, it's not necessarily about rehabilitation, it's more about punishment. And so being able to provide a program where you're providing rehabilitative services in a wraparound fashion, like Nick mentioned, I think we have very many success stories that we're proud of and are proud to call the Bridge Homes and our ODR programs of the Alcott Center.
It's amazing. And listening to this, I feel that mental health is also very much dependent on the external factors, if I may put it that way. And more rough the external factors are, you are more prone to face such challenges, or you might even become more sensitive. So how much do you think it affects, and does this mean that so if we talk about the government, or if we talk about a community in general, if that is secure, safe, and the government takes good care of its citizens, so we will face lesser mental health problems?
Yes, I think more funding is needed. I think mental health is really about the way we think, the way we express emotions, and the way we really interact with one another. The more funding available, the more services available. The more services available, the more people are able to access, and they need to be affordable services as well. But the more people are able to access those services, and I think I think one good thing about the pandemic is that a silver lining, I suppose, is that the stigma around seeking services for mental health has really decreased. And what we're seeing is a greater demand for our services, but we're not seeing a greater amount of funding. So that's a challenge right now, because we have people banging on the door to get in that we can't necessarily accommodate. And it's not just with us. This is like, I think nationwide, there's just more of a demand for the services than there are the services right now, and both in the public and private sector. I do think that if the government stepped in and provided more funding, there would be an absolute difference. And I think it would improve communities, it would improve individuals. And if individuals are improved within a community, then the community as overall is also going to improve.
Yes, I guess that drives home the point that if it's not solely a governmental responsibility, and it's more like it's more community. So people help people who end up helping other people. That is absolutely correct. And like I say, people are a very integral part of the cycle of healing. So what do you think people should know more about mental health so that the cycle is more stronger and it's more interlinked to each other?
Well, I think that people should know that having a mental health challenge is more common than they probably think. Everyone probably knows somebody experiencing a mental health challenge. And if they don't see it, it's probably there. There are people in high levels of offices that have significant mental health challenges. I always think of Abe Lincoln. He had significant depression, yet he was the president of the United States. So I think that people need to know that it's out there and it's common, and it's okay to talk about. I think that people need to know that it is treatable, that there is hope. I think the sooner you get at it, the better. I'm always happy to see when sort of the 0 to 5 age range, there's a lot of education around there and a lot of prevention going on with that population, because you really want to get to the root of a mental health challenge early. It's the same thing as heart disease. If you get it early and you treat it early, you're going to have a better outcome. I think the other thing that I would like people to know is that when it comes to addiction, addiction is a disease. It's not a sign of weakness. The same is true of mental health challenges. They are not a sign of weakness. They are caused by biology, genetics, environment, socioeconomics, all of those things, really.
I think Nick said it perfectly. And, I guess I would just add that my greatest hope is that we're all more comfortable talking with each other and sort of building a community together. Because I think, especially in the United States, we've become a very individualistic nation. And I think people feel oftentimes that they have to, find support on their own and like they're going through this journey alone. But really, we're all in this together if the pandemic has showed us nothing else.
Yes, it's rightly said. And like Nick also mentioned, and you also iterated the fact that this is something that cannot be fought alone. And people should wake up, and people should realize that they just have to go out and tell the right people that they are not doing okay, and help will be there for sure. So since you have been in this field for so long, there must have been some positive growth in awareness around mental health and people getting cured out of it, and like we talked about the cycle, so the cycle getting continued. So is it really positive, or has it worsened? Because I have read news articles and people have also said that COVID has made it even worse because people are not able to socialize, they are locked down in their rooms. and uncertainty around life. So has it gotten worsened, or is it improving?
Well, because of COVID, it absolutely got worse. And I think, to your point, there's a lot of isolation that happened especially during the lockdown periods. In addition, our therapists couldn't go out to some sites to see people, and they had trouble, connecting. Not everybody is good at virtual services. Not everybody is able to navigate them. So, some people got worse. And I actually think even coming out of the pandemic, there's still a greater need. People don't really, I believe that a lot of people got depressed during the time of the pandemic, and I believe that they languished for a very long period. And they may not even see it as depression, but now that we're coming out of it, I think that they're probably noticing it more, and they're not able to, people don't know how to resume their life as normal, because we don't really know or understand what the new normal is yet, and that's scary. So I think that there's even anxiety and some sadness about coming out of it. So all in all, I think it got worse, and the demand for services certainly went up, continues to do so. Ashley, I don't know if you want to add.
I tend to be an optimistic person, so the only thing I would say is kind of echoing back to what you said previously, is that I think one thing that got better was more people being able and willing to talk about mental health, because I think, the fact that so many more people may be experiencing these things like anxiety and depression makes it almost more normalized to talk about.
So, like you rightly said, COVID really taught people about mental health, and it showed them that it's not something that's made up. And also, COVID also restricted people from getting help. That is something that every one of us would agree on. But so where do we see ourselves? Because if we think about it, people are more aware, but as people are more aware, they are coming out more. So this means that the number is increasing. But since they are not getting the required care or required services, it's not really helping anyone. So where do we see ourselves after like 10 years? Like, how is it gonna get okay?
Well, I would hope that with the reduced stigma and the increased demand, that there would be more funding available to serve the people that need to be served. 10 years is that's a long time to project out. I think that there's a bit of a change in the workforce, which also impacts this. And I think that there will be a lot more telehealth types of things available, which is good because it makes it more accessible to more people. I hope that it will improve. My pessimism is trying to get the better of me right now, because there's so much going on in the world. I mean, the pandemic, what that's caused, coming out of it, all of the things in the world going on right now. I mean, the war, this country is going through a lot. So there are so many reasons that I think people are feeling more stressed. The optimistic part of me says we need to get through the hard part and then over the hill, and then we'll see a brighter light where services will be available to anyone who needs them at little or no cost. That's my answer. Ashley.
I think it largely is dependent on our ability to create this sort of connective tissue amongst our communities, amongst our policies, amongst our governments, and even in the globalized world that we live in. Like, I think, if we're able to build our community stronger, build ourselves stronger in the coming years through being able to access these more affordable resources and being able to talk to each other and just having more even virtual spaces to come together as, people, I think we could be hopeful. And, like, ideally, it will be better 10 years from now. I think that's what we all hope for, right? That the effort that we're putting into being able to provide these resources on a daily basis leads to hopefully a greater impact in highlighting the power of the resources that we're able to provide and what that can bring to a community, and hope that that is then re-illustrated in different models around the world.
And I feel hope is something that always keeps us going. Well, I asked that question because I heard about a university that not only talks about taking care of mental health of its students, but also acts on it. Because there was an incident where a student went to the university authorities and said that I won't be able to take the semester exams, and the university exempted that student from the exams. And he or she was given the freedom to choose if they want to give that exam in future or not. So this is what I see as a future of mental health, because it should, since it's there in the head, you can't really see it, and because you cannot see it, many people do not take it seriously. So it should be equivalent to a physical damage or a physical wound. And mental wound is equal to physical wound. So if I get a cut in my hand, I'll just go to a medical store, I'll get a band-aid, and that's it. I'll be good to go in 1 or 2 days. So it should be that accessible, like Ashley said, it should be that easy. And the very main thing is it should not be stressed upon. Because if
Agreed.
you have gotten it, you will get out of it. It should be that easy.
Well, there should be parity. I mean, with you can't have good physical health if you have bad mental health. They all work together: physical, mental, behavioral, spiritual, general well-being. If one thing is off, everything is off. And in this country, there is not parity between mental health and physical health for sure. Just looking at insurance companies, I mean, they will, they won't pay the same way that they pay for physical stuff. And then you add in the stigma. People will go to the ER with a cut, but they might not go to the ER if they're feeling suicidal because of the stigma attached. And I think the more work we do around breaking stigma, the greater relief people will have. But services also need to be there in place.
Yes. So if somebody, like we'll be having down the line, if we have any online activities, we'll be having volunteers who will be coming on the call and will be volunteering their time. So what kind of help or what kind of activities would you expect from such events? Like what is it that we can do to help the cause and help whatever work that you are doing right now?
I think one major thing in terms of what volunteers can do virtually is even creating, cards to go in our welcome home baskets, or inspirational banners to put up in our mental health center, so that way people can see that there's a community behind the work that they're doing on themselves. I don't know if you have anything to add to that, Nick.
Well, I guess, like I was thinking, board members are always useful, especially when they have experience in certain areas, and people volunteering that are, more local, I guess. We're always looking for board members. And I would also just do a plug for the workforce too, because the workforce has really changed. And, at least here, when people go to school and they get their social work degree, if they work for a nonprofit for a couple of years, they can have all of their tuition costs waived. And the workforce is in desperate need of people. And, the salaries are not bad. They're pretty good, actually. So I know we're talking about volunteers, but since we're talking about people that might be on the call, I think it's worth mentioning that.
And I would just add that also donations are always helpful if people are in a position to do that, because that helps us to increase the impact of both mental health and housing services and be able to serve even more people. We're anticipating on serving about 2,000 people here in Los Angeles next fiscal year. So if anybody has the capacity to donate, then it will definitely go to good use.
Perfect. We make sure we also pass on the same message. And I think Nick pointed on a very nice point where he said that it's not a matter of 1 hour or 2 hours or a couple of months, a couple of weeks. It should be something that people consider as a bread earning opportunity as well. So yeah, correct. That's absolutely correct. So with this question, we are going towards the end of the interview. So my next question will probably be my last question, and I would like to know what is the last message that you would like to give to our viewers?
I would like to give a message that I haven't stated earlier, that people with mental health, there's often a myth around people with mental illnesses being violent. And I would like to point out that people with severe mental illness are generally more likely to be victimized than to be to be violent towards others. And I don't think that there's a good understanding of that at all. And it's important because, especially as we talk about releasing people from incarceration that haven't been violent, but I think it's just important to know that the research has really shown that people with mental illness are not generally violent, no more than the general population. And then the other thing, as I had mentioned earlier, that mental health is not a weakness. It's not a sign of laziness. It has, as I said, many components to it. And we really need to look at it more so as a physical disease, like a brain disease, I guess, would be one way of doing it. You have an earache, you go to the doctor. You're feeling anxious, you talk to somebody. It's the same thing. If you're feeling like you need faith in your life, you go to church. It's all the same. And it's all really a small part of everything that is bigger, the small part of the whole. So, Ashley.
Well, echoing everything that you said, Nick, I would also just like to add, take care of each other, because it's difficult enough to go through life, I think, and you can make a big impact even just talking to the people around you that you're close to and being there for the people around you, and just giving your strength to others and letting others give strength to you. I think there's a lot of power in that, and can also lead to maybe people getting more help that they need in terms of mental health, because it is real and it is something that we all need to talk about more.
Yes, very important. We are only talking about talking, but then listening is active listening, so it gets a little hidden somewhere. And like Ashley mentioned, that only people can help people, and that is something that no matter how you emphasize on, it's always less. And like Nick said, there's a difference. So people who are suffering from such issues, they're not lazy. There's a difference between I cannot get out of bed and I don't want to get out of bed. So this is the difference that people have to understand. Thank you so much, Nick. Thank you so much, Ashley, for agreeing for this interview.